My audience, 1, 2, 3, 4, 5 adults. Okay. All right, guys. So my name is Stephanie. I've been in the medical field for about 10 years, and currently I work as a medical assistant at family practice at OBGYN. So today I'm going to be talking to you about how to prevent UTIs, what a UTI is, and what to do if you do have one, how to give a proper urine sample for a urine culture. So how many of you guys have ever had UTIs? Raise your hands.
I have.
So surprising, right? That's the majority of us. So UTIs are so common that we see about 4 to 5 patients a day that come in for UTIs. So let's see. So why is it important? So even if you've never had a UTI, you can still get one in your lifetime, and you need to be able to recognize the symptoms, what to do, why did you get a UTI, and then obviously how to give a urine sample for that urine culture. So the CDC says that UTIs occurs when the bacteria enters into the urethra and infects the urinary tract. So the most common UTI is a bladder infection. So sometimes our microbes can kill off that bacteria, but most of the time we need antibiotics. So they also mentioned that if the infection gets too bad, it can travel from the bladder into the kidneys, causing a kidney infection. So the CDC says people that are at higher risk are women and girls because we have shorter urethras and because our urethra is so close to the anus than in men. So how to prevent UTIs are the most common reasons why people get UTIs, or the most high risk. So people with previous UTIs, sexual activity, menopause, use of spermicides, pregnancy, older adults, reduced mobility, kidney stones, and prostate enlargements. In children, UTIs can be most common because they don't wipe correctly. For example, they don't wipe from front to back, they wipe from back to front, which causes that bacteria from their anus to come up into their urethra. So also structural problems, or sometimes kids get too busy, they're playing outside and they don't want to come inside to go pee, and so they hold that urine and never let it out. So the symptoms, the first and most common symptom is painful or burning urination, urinating often, feeling the urge to urinate even though you've emptied out your bladder, low-grade fevers, cloudy or bloody urine. So prevention, urinate before and after sexual activity to help flush that bacteria from the urethra out, drinking plenty of fluids, urinating often, showers versus bath, especially for children, douching, personal sprays, powders in the genital area, and teaching girls to wipe from front to back. So once you recognize the symptoms and think you have a UTI, make an appointment with your doctor. They're going to ask you for a urine sample. So they will test that urine for a urinalysis dipstick. So the urinalysis dipstick consists of checking the clarity, and according to WebMD, the clarity tells you if the urine is cloudy or clear. Things that can make your urine cloudy would be bacteria, sperm, or mucus. They also test for smell. So bacteria can make urine have a really bad odor. But the most important they look for in a UA for a UTI is leukocytes and nitrites. So leukocytes are white blood cells. White blood cells show that an infection is present because white blood cells are trying to kill that bacteria. Nitrates are also, they also show a UTI because urine nitrates are converted into nitrites when there's a bacterial infection in the urinary tract. So once a UA is done and it comes up with nitrites and leukocytes, your doctor is going to ask you for a clean catch urine sample for culture. The urine culture is spread across an agar plate. It's incubated for 2 days to see if the bacteria grows on a petri dish. So if the bacteria grows, they see if the antibiotic will kill it. So they'll test different antibiotics inside of that petri dish, and whichever antibiotic kills the bacteria the most, that's going to be your best cure to kill off that bacteria in a UTI. So sometimes if you don't give a clean enough urine sample, your culture is going to come back as contaminated. So that means that you didn't follow the proper procedure for the urine culture. So WebMD says how to properly collect a clean catch midstream urine collection. So I'm going to show you how. So first you're going to wash your hands. You're going to be giving a urine cup and 3 wipes. These are benzoylalkyl chloride antiseptic towelettes. So you're getting 3 of these. So after you wash your hands, you're going to remove the lid. You're going to make sure that you don't touch the inside of the cup or the inside of the lid. The lid's going to go facing up so that the lid isn't touching anything. So you can set your cup down. So I'm going to do 2 separate demonstrations. The first one is for a woman. So you're going to spread out your labia. With the first wipe, you're going to wipe on the left side from front to back. Grab the second wipe and wipe the right side from front to back. And with the third wipe, you're going to wipe from the middle from front to back. For a male, you're going to wipe on the left side from front to back. Second wipe front to back on the left side or the right side. And then front to back in the middle. So once you're cleaning, for women, you're going to always keep that labia open while you're giving your urine sample. So you're going to urinate into the toilet for about 2 seconds. Never stopping the flow, and then you're going to urinate into the cup until you get about 2 ounces and finish urinating into the toilet. Once you're done with that urine sample, you're going to grab your lid, making sure not to touch the inside. Close the lid, write your name, date of birth, time that you did it, and the date. And then you're going to return it to the nurse or whoever gave it to you. So in conclusion, you're going to write from front to back to prevent UTIs, again, that bacteria from the anus getting into the urethra. You're going to, by avoiding UTIs, it can save you money. That includes a doctor's visit, medications for antibiotics, and labs that are done. A urine culture can cost you guys up to $100 every time they run that urine for culture, so it's important to get a good sample that first time around. So it's important for me because a lot of my patients come in for UTIs, and most of them are on a budget. They can't pay a lot of money. They're in pain. And some people are not trained on how to give proper urine collection, so they have to repeat that urine culture, which costs them $100. And they have to probably get in again to be seen by the doctor, so that's another doctor's visit and copay. So also to remember that overusing antibiotics, every time you use an antibiotic, your body gets used to it and becomes resistant to that bacteria. So the more you use antibiotics, the less it's going to work. So I have a couple of pictures. I've got the bladder, and you can see how close it is to the anus and how close that bacteria can run up into your bladder. That's a woman. This is E. coli under a magnification, and then this is E. coli in a petri dish once they send it in for culture, so that's how it'll grow. This E. coli is also the most common bacteria that you find in a UTI. So again, remember to prevent UTIs, use the proper urine sample for a urine culture, which is the clean catch midstream sample. And that's it. Thank you guys for staying and watching. Record everybody around again. Make sure everybody stuck around for my whole speech. Stop.